Hey, how are you doing? This is Dr. Erickson with Executive Health Solutions. I'm going to teach you today about some shin pain. A lot of times we call this shin splints. Now in this example, I'm actually going to use my daughter. This is not just an educational thing as an example. This is actually, she's actually having this pain. Now in her situation, it's kind of a combination of getting done with the volleyball season, starting track, and starting soccer. So that increased volume of running is what has brought the pain on the inside of the shin. So most people will think of this as that garbage pail term is shin splints. Now, it can be two different things, well, a couple different things. With her, the differential diagnosis we had to go through was either a medial tibial stress syndrome. So medial just means the inside, tibia is the big bone right here. And especially in young girls, she's 13, she's still growing, putting a lot of stress on her body as she's doing all this running. The muscles that attach to the inside of the shin, so her pain is in a line about right there on both sides, okay? The muscles that attach to that shin bone are very strong. There's a covering around the bone, like a skin around the bone, the big shin bone. That's called the periosteum. And that periosteum, when the muscle starts to pull and tug on that periosteum, that is painful because that is where the nerve endings are. When you break a bone, that's why it hurts, is because you disrupt that periosteum. You end up tearing and hurting that periosteum. So with her, it's either going to be that periosteum and that medial tibial stress syndrome where all these muscles here are just kind of starting to pull away because of all the running. The other thing that she has going on is one of the deep muscles in the leg called your posterior tibialis runs right in that area. It runs right behind the ankle, and then it attaches down here. It's a strong inverter, and it's called plantar flexion. So inversion means rolling it in, and plantar flexion means up on your toe. So now she can come up on and do like a heel raise with a little bit of pain. If excuse me, if you had someone that could not even lift their heel up, that's a problem. I mean, that needs some significant rest. With her, total rest is not really an option. So we're going to modify the activity. She's getting a little bit of rest. We're treating it here at home. I'm going to show you a taping technique to work on it. And then she's icing quite a bit too. So anti-inflammatories, and NSAID, ibuprofen, ice, modified activity. So at times she'll work on just handoffs and not the long runs. Or in soccer yesterday, she got a game today, which is why we're doing this. She'll get subbed in and out, so that's not too much running on there. Huh? Okay, so here's how we're going to take care of this one. Hers is very painful right in there. Yes, right in there. So now this posterior tibialis tendon runs down through here, and the medial tibial stress. So we're just going to take care of both of them. Okay. So I'm going to start with, in her case, some tough skin. Now, if busy professionals that you guys are, when you have children that are in this athletic population, this is what we're looking at, and this is hopefully how you can help it. Or if you have access to an athletic trainer at the school, this could be something they could do. But I just want to educate you how to do this here. So we're going to spray this a little bit with tough skin so it sticks better to her. And I'm going to get it all over my table. Okay. I have to wash that table off.
That's your problem. You made me sit on this table, so now,
What, buddy?
if you're going to do this.
I moved away. I don't smell that, okay?
Okay, it kind of smells funky, doesn't it? All right, she's
Smells
gonna
like chemicals.
She's going to pull her foot into what's called dorsiflexion. And basically what I'm trying to do is I'm going to try to lift the arch a little bit through here and not allow, because every time she's running, that a little bit of what's called pronation, a little bit of heel kind of tips in, and she's just tugging and tugging, or tugging on that shin bone, and that starts to hurt after a while. So the posterior tibialis is a kind of helps lock that ankle in place and keep that arch high. So we're just going to kind of facilitate that and aid in that a little bit. So what we'll do is I'm going to use a little bit of, I would normally do this with a kinesio tape, but we actually don't have any right now. I'm out. I ordered it. It should be here. So I'm going to go around the foot, and I'm going to trace right up this ankle bone. And then I'm going to just lay this down. This is a stretchy tape though. And right in there. Hope that didn't tear very well.
No, it didn't.
There. Okay, I'm going to lay that down like that.
It's hurting my core. So this is hurting my core.
You can't sit up that long?
No.
She also hurt her thumb yesterday. Or no,
And my
her
pinky.
pinky finger
Like, look at how swollen it is.
falling, so I got to tape that next.
And then my thumb, I put too much pressure
Hold this one
on.
here.
And I got whiplash falling, so.
She got fouled. It happens.
And he didn't call it.
And she's complaining.
That was an obvious foul. How do you not call that?
They don't call everyone.
Oh, but then they call when I slightly push the girl in the back?
That's right.
It's complete bullcrap.
Hey, now, we're making educational videos, dear. Okay. I'm also going to put a couple of, I'm going to come down here on my knees. Let's go back to the right one here. So, all right, so she's here. She's going to pull back into that. I'm going to add a little firmer, like actually hard white leg tape. Move this leg to the side. There.
Sorry.
And I'm going to take this and come around here and just reinforce some of this here with a little bit of firmer tape right in there. Just to kind of help her lift that arch and protect and kind of facilitate that posterior tibialis muscle and give some support to that shin bone so that if things don't start pulling away, we're going to kind of support that shin bone a little bit. Okay, other foot. So this is when we've been doing this since last week.
Yeah, probably.
Late last week.
Thursday.
She had a day
Thursday.
last week after a track practice, hold up right there, where the pain was significantly increased. And luckily she told us about it right away. So we were able to work on this thing and start working. Now the other thing that we have been doing, I'm not going to show in this video per se, but in that spot, right off, so if you feel the hard shin bone and you drop just inside where it gets soft, that's where her pain is. So I've been using either my finger or a little metal tool that I have to give a little cross friction in there and get that tissue, because it's already irritated, so I'm going to try to help facilitate it and get it to calm down a little bit.
It feels like
giving a
you're
little cross friction.
irritating it even more. That's what it
hurts
feels
at the
like.
time, yes, but it helps that tissue heal. A little soft tissue mobilization we've been doing as well. But the purpose of this one is just to give this taping video here of how we, for the day, how we're going to take care of this today. Like I said, the overall treatment is going to involve some modified activity, some rest, some ice. She's also going to start working on inversion and eversion and dorsiflexion strengthening as well.
Well, because you don't want to let it, you don't want to rest, because then you'll just be back at square one. Because then if you try to go back and do it again, it's just going to hurt again.
If the
But you don't.
If the tissue doesn't heal correctly, yeah.
But then
What she's saying is you could just rest and do nothing. Hold on, buddy. You just rest and do nothing, and yeah, it'd eventually feel better. But if that tissue doesn't scar down and heal appropriately, when you start running again, you might just feel it all over again. Okay, so we're working on getting this thing. So this is her tape job for today. She's got a soccer game here coming up, and we have to get going to church here pretty quick. But any other questions that we had? Did you had on this one? Hi. Any other questions that you had on this one? Just drop them in the comments below. This is just for that shin splints or that medial tibial stress syndrome, another way to term it, or the posterior tibialis tendon that gets irritated. Now the posterior tibialis tendon typically is, bring the camera down this way, typically hurts more down here, behind, like right in there. So that's not really where her pain is. I mean, that's usually where that tendon hurts if it gets irritated. Hers is more up here. So we're thinking more of that medial tibial stress, but the muscle's up there too. So it doesn't have to be the tendon. It could just be the muscle itself, or any of the muscles, the tibialis anterior, the posterior tibialis, thank you, or any of these anterior medial muscles by the shin. Okay, thank you very much.